Hello everyone, and welcome back to our channel. Today we're delving into the world of USMLE Step 2 CS cases, focusing on one of the most critical aspects, differential diagnosis. Mastering the art of differential diagnosis is essential for success on Step 2 CS, as it demonstrates your ability to think critically and formulate appropriate management plans for patients. So, join me as we explore strategies and examples to help you ace differential diagnosis on Step 2 CS cases. Let's dive in. Differential diagnosis is the process of considering multiple possible diagnoses based on a patient's presenting symptoms and signs. During USMLE Step 2 CS, you'll encounter a variety of cases where you'll be required to develop a differential diagnosis and select the most likely diagnosis or diagnoses. Let's discuss some strategies to help you excel in this aspect of the exam. The first step in developing a differential diagnosis is to gather comprehensive patient information. Pay close attention to the patient's history, including the onset and duration of symptoms, associated factors, past medical history, medications, allergies, and social history. Perform a focused physical examination to identify pertinent findings that may aid in narrowing down the differential. When formulating a differential diagnosis, consider common diagnoses that are likely to present with the patient's symptoms and signs. Start by thinking about the most likely diagnoses based on the patient's chief complaint and associated features. Consider both acute and chronic conditions, as well as common presentations of less common diseases. Develop a systematic approach to differential diagnosis to ensure that you consider all possible causes systematically. Organize your differential by organ system or symptom category, starting with the most life-threatening conditions and working down to less urgent diagnoses. Use mnemonic devices or algorithms to help structure your thought process. Be alert for red flags or must-not-miss diagnoses that may indicate serious or life-threatening conditions requiring immediate intervention. Pay attention to key features such as sudden onset of symptoms, severe pain or distress, vital sign abnormalities, or neurological deficits. Prioritize these diagnoses in your differential and consider them early in your management plan. Clinical reasoning is essential for developing a logical and evidence-based differential diagnosis. Consider the pathophysiology of each potential diagnosis, including risk factors, underlying mechanisms, and common presentations. Use clinical judgment to weigh the likelihood of each diagnosis based on the available evidence and patient-specific factors. Diagnostic testing plays a crucial role in confirming or ruling out differential diagnoses. Consider appropriate laboratory tests, imaging studies, and other diagnostic modalities based on the suspected diagnoses and clinical context. Interpret test results in the context of the patient's overall presentation and adjust your differential accordingly. On exam day, approach each Step 2 CS case with confidence and a systematic approach to differential diagnosis. Take your time to gather patient information, consider all possible diagnoses, and prioritize your differential based on clinical judgment and evidence-based reasoning. Communicate your thought process clearly and confidently to the standardized patient, and be prepared to defend your differential with supporting evidence. In conclusion, mastering differential diagnosis is essential for success on USMLE Step 2 CS. By gathering comprehensive patient information, considering common diagnoses, developing a systematic approach, recognizing red flags, employing clinical reasoning, and utilizing diagnostic testing effectively, you'll be well prepared to ace this aspect of the exam. Thanks for watching, and best of luck on your Step 2 CS journey. If you found this video helpful, don't forget to like, share, and subscribe for more medical education content. See you in the next video.